Good afternoon. My name is Daniel Moore. I am a student at Alcorn State University's Nurse Practitioner program. Today we're going to be conducting a small health history and a focused assessment of the cardiac, peripheral vascular, hair, skin, and nails. Ma'am, could you state your name and your age for me?
Candace Moore, and I'm 25.
Okay, thank you. We're going to go through a brief health history and then perform a small examination. Do we have your permission to conduct this examination?
Yes.
Good deal. Okay. So you're 25 years old. Do you have any chronic illnesses such as asthma, diabetes, hypertension?
No.
All right. Do you take any medications?
Just birth control called Ministrin every night.
Okay. Nothing else? No over-the-counter remedies or anything like that?
No.
Okay. What about allergies to medicine?
No.
Any environmental allergies?
No.
All right. Any food allergies?
No.
All right. Have you ever had any kind of operation? Your tonsils out or anything like that? Any surgical procedures?
No.
Okay. Any overnight hospitalizations?
No.
Okay. Are your immunizations up to date?
They are.
Okay. Have you had a tetanus shot in the last 5 years?
I have.
Good deal. Did you get your flu shot this year?
I did.
You did. Okay. At this point, we ask about immunizations. If the patient was over 60, we would ask about the Pneumovax, which is once every 5 years, and the herpes zoster vaccine. But since the patient is under 60, tetanus, flu, these are our normal immunizations that we'd ask about during the course of a health history. Okay, what about tobacco use? Do you use any tobacco products?
No.
Okay, alcohol?
No.
All right. Street drugs, marijuana?
No.
All right. What about exercise? Do you get regular exercise?
About 30 minutes, 2 to 3 times a week.
Okay. About how much do you sleep at night?
Between 6 and 8 hours.
Regular patterns?
Yes.
Okay, good deal. What do you do for work?
I'm a nurse.
You're a nurse. Okay, so what's your highest level of education you've achieved then?
A bachelor's degree.
Okay, good deal. All right. Do you drink any caffeine or energy drinks?
About a cup of coffee a day.
Okay, good deal. Let me ask you about your family a little bit. What about on your mother's side? Any chronic illnesses or diseases such as cancer, hypertension, diabetes, anything like that?
My mother has hypertension and high cholesterol.
Okay, what about her parents?
Not that I know of.
Okay, and what about your father?
He has high blood pressure, and my grandmother had Alzheimer's.
Okay, all right. Any siblings?
Yes.
Okay. What are their ages?
20 and 17.
Okay. Do they have any chronic illnesses such as asthma, diabetes, or anything like that? Okay. All right. Good deal. All right. We've gone over a brief health and social history. A couple more questions, and we'll move on to our assessment. Do you have a religious preference?
Christian.
All right. And what about your sexual preference? Are you sexually active?
Yes, and males.
Okay. All right. Thank you. All right. I guess now we can move on to our assessment. Let me just perform hand hygiene first, and then we will start with the head, skin, and nails. We're going to start, just observe the shape of the head. It's round, normocephalic. We're going to part the hair and feel the back of the head for any lesions, indentation, signs of trauma. No bumps, indentations, any signs of previous operations or trauma. We're going to assess the hair. It's fine, straight, dark brown, black in color. The texture is smooth, firm. The overall appearance of the patient is no odors or unkemptness found. The patient appears to be in good hygiene and smells fine. All right. Now that we've assessed the hair and the scalp, we're going to go ahead and move on to the mucosa. Grab my otoscope. Can you stick your tongue out for me? Good. All right. The tongue is moist. No lesions noted. Buccal mucosa is pink, moist. All right. Conjunctiva. pink and moist. All right. There's no yellowing, the sclera, no corneal arch around the pupil, which would be indicative of hyperlipidemia. Again, the conjunctiva is pink and moist, no signs of anemia. I'm going to go ahead and assess the face, the skin on the face. I'm looking for nevi. I see some small nevi, appear to be freckles. You would want to examine each of these for pattern. These appear to just be generalized. You want to go by the A, B, C, D, and E's. A is asymmetry, B, borders, C, color, D is diameter, and E is elevation. Anything over 6 millimeters, you would want to refer to dermatology. All right. So now that we've done that, we're going to continue with our skin assessment. Feeling for temperature now. The patient's warm, skin is dry. Skin is warm and dry, smooth. No discolorations. It all appears to be one color. All right. I'm going to check turgor. Brisk return. All right. It's elastic. Goes back down just as soon as I pinch it. All right. Turgor appears to be normal. Temperature is normal. No lesions, nevi, abnormalities noted on the arms. All right. We're going to go down to the nails. We're going to inspect the cuticles and check capillary refill. The patient has artificially painted nails. It's hard to check capillary refill, but they appear to be round. Thickness is within normal limits. Cuticles are clean. There's no yellowing or blue that would indicate cyanosis, either at the nails or around the mouth circummoral. Feeling both palms. Warm. All right. Now we're going to move down to the lower extremities and just take a look at the legs. Normally we'd be looking for hair distribution. Any irregular hair distribution would be indicative of poor circulation or peripheral vascular disease. Checking turgor again, warmth, temperature. No lesions, nevi, cellulitis, anything like that noted. Everything is dry, smooth, no abnormal findings. Last, I'm going to check the axillary skin folds. All right, they're dry and warm. All right, now we have assessed the skin, hair, and nails. All right, from there, we're going to move on to our cardiac assessment. First thing we're going to do is look for jugular vein distension. Ma'am, if you could turn your head that way for me. Thank you very much. All right, we're looking just above the clavicle. External jugular may be visible. Looking for the internal. If it's above 2 centimeters, it might be indicative of right side heart failure or portal hypertension. No JVD noted. I'm going to go ahead and palpate the carotid pulse. Can you turn it this way for me? Carotid pulses appear to be within normal limits. Good strong pulses. Now I'm going to auscultate carotid. No abnormal whooshing sounds or thrills. All right, now I want to get down eye level and inspect the chest. Just relax your shoulders back there for me now. What I'm looking for is any lifts or heaves, any abnormal pulsations. And then I want to look in the fifth intercostal space, mid-clavicular, to see if I can see the PMI. Sometimes if you have trouble seeing it, you can move the patient on the left lateral recumbent side. All right, now that I've inspected, I'm going to palpate. All right, I'm going to start aortic. All right, and I'm feeling for any kind of pulsations or thrills. Slowly move across the sternal border. Right. I'm going to take both hands and palpate the aortic area and the mitral. Keep your hands by your side for me. Thank you. And again, I'm assessing for pulsations, thrills. I'm going to find the point of maximal intensity, the apical pulse. It's usually the fifth intercostal space, mid-clavicular. Again, if you have trouble feeling this, you can turn the patient on the left side. Now that we found the PMI, we're going to have a listen. We're going to start here at the second intercostal space, just to the patient's right of the sternal border. All right, it's aortic. And now pulmonic again at the second intercostal space, just to the left of the sternal border. Listening to S1 and S2. All right, now we're going to go down to Irv's point. Then the tricuspid. And then the mitral. We can hear S1 and S2. Good strong pulse, approximately 60, 64 beats per minute. Now we're going to auscultate with the bell. We're listening for bruits, which is like a whooshing sound. We're going to listen for the whole cardiac cycle. S1 and S2. S3 would be heard after S2 and S4 before S1. So that's aortic, pulmonic, Irv's, tricuspid, and mitral. Now we're going to have the patient move to the left side, in the left lateral recumbent position. We're going to listen for mitral valve regurgitation or stenosis. Good deal. All right. Now that we've done this at 30 degrees, we're going to have the patient sit up and lean forward. There you go. All right, now we're going to start where we did again, and we're inspecting. inspecting the chest, we're looking for heaves and lifts. You lean forward for me just a little bit now. There you go. All right. And now we can visualize the PMI. We're going to listen again. Second intercostal space. Over here, pulmonic. Down the sternal border again. We're listening for high-pitched sounds with the diaphragm and low-pitched sounds with the bell. No bruise noticed so far. Again, right down the sternal border. Oops, sorry. Mitral. All right. Now that we've listened to our heart sounds, we're going to finish our peripheral vascular part of the exam by palpating the rest of the pulses. We've already done the carotid, so we're going to move on to brachial. Radial. Press your legs for me, man. And we're going to palpate the popliteal, which is right here in the middle of the two gastrocnemius heads. And then the posterior tibial, which is right here behind the medioli. And then the dorsalis pedis. Right on the top of the foot. Both pulses are within normal limits bilaterally and easily palpable. And if you could lay that for me one last time, I just want to do those for the camera. Bend the knee up for the popliteal. Posterior tibialis and dorsalis pedis. Good strong pulses. All right, so we've done the head, hair, skin, and nails. We've palpated all of our pulses, listened to all of our heart sounds. We have no abnormal findings. This will conclude our assessment. Thank you so much for participating today, man. All right, let's do just a quick show around the room here. And this concludes our assessment.